going to be quite swollen, heavy, and a lot of patients are non-weight bearing, so we have to think about what is their weight bearing with this, okay? So that's the cam boot. The other two that I want to explain real quick are we have a ton of these in the back. These are for, who do you think uses an air cast? What type of, yeah, ankle sprains, exactly. So acute ankle sprains, this will help. There's some directions in there if you want a bunch. Good thing that you have the other shoe. Okay, so we'll take off this one. Sam really did something to himself, so.
Good job.
So this is called an AFO. This is very commonly used for what type of diagnoses? Yeah, neurological. So usually drop foot. I have had patients who've had severe bimalleolar fractures or lower extremity fractures, and they actually damage their nerve, and then they end up with drop foot, which really sucks. And they don't know until they're all getting ready to heal, and we're trying to work on dorsiflexion, and they can't do it at all. So what this is called an ankle foot orthotic, so abbreviated AFO. When we put this on, we want to make sure that your heel goes all the way back here, and we're going to secure this nicely around your calf, and we'll want to make sure that this isn't rubbing in when you're actually walking, so we'll pay attention to that, okay? But whenever you wear this, you need to have a shoe on. That helps to keep this stable. So if you're not going to be wearing shoes and you want to get up and go into the bathroom, you need to maybe have some nice slippers that you could put this on, and then the slipper over top, okay? Many patients will put this on, try to walk. It's very slippery, could cause them to fall. Okay, has to be used with a shoe. There's a lot of different types of versions. This is called an off-the-shelf AFO. So we want to get the heel back as far as possible. This is a little too small for him. Where we want it to fit is really actually right up at the top of his metatarsals, so that his toes actually can come above it, because we don't want to block toe movement. We just want to support the ankle. This is also going to help with at the knee. What do you think it could help prevent? What? Yeah, hyperextension, rock or bottom. So a lot of patients after CVAs, we use this to help with drop foot, but it also can reduce that rocker bottom that is often. So we're gonna put this around. So I'm gonna have you actually wrap that around, and we wanna make sure that you can fit 2 fingers underneath. Can you do that for me? So the patient has nothing wrong with usually the upper leg. They can move, and they can just put that on. We want to make 2 fingers. And you'll remember that for pretty much all of the orthotics going forward. It's a 2-finger fit so that we make sure that there's enough blood flow, but it's tight enough to get them support. And then we put the shoe on over top. Okay? So those are the 2 main ones. You have these the ankle air casts, which are pretty self-explanatory, but you put the foot down in the bottom, and it's kind of just like a stirrup. The patient again is going to wear their shoes with this, and it's just going to come up and around the ankle to support them like this. Okay. Yeah, poor Sam. Motor vehicle accident. Yeah. Yeah. All right. So, any questions on these?
Oh.
Yes.
That little pad, the black one, yeah, what was it supposed to
So
do?
some patients, after they wear the cam boot, they might say that they have a little bit of friction around the malleoli or in the front. Yeah, some people might need it underneath their heel to put them into plantar flexion after having an Achilles tear. So a lot of times these come with like 18 of these, and we have a trillion at the bottom there. But they're if the patient has like consistent friction or feel a little uncomfortable. But there's one that's already sewn in there to protect the front of the ankle. But these can go at the top of the foot here if they get too much rubbing. Yeah. So and some patients like to put it up here at the top to support them. So